Hello and welcome to BGE Pulse, the podcast where we talk to members of the Georgetown Biomedical graduate education community to learn about their careers and what they studied while they were at Georgetown. Today we talk to Zoe Aziz, a 2019 graduate with an MS in Systems Medicine. Zoe went on to earn her MSN at Columbia University and then her DNP at Sacred Heart. She now works as a nurse practitioner at Memorial Sloan Kettering in New York City. It was a pleasure to speak with Zoe, and I look forward to sharing my conversation with her. So I started recording.
Cool.
Um, can you talk to me about sort of the systems program at Georgetown, when you were there, what you studied, and like kind of what you got up to while you were at Georgetown?
Yeah, absolutely. And so when I graduated from my bachelor's program, I kind of didn't know what I wanted to do. I knew I wanted to do something clinical, but I was a little bit lost. And so my last semester in my bachelor's program, I did like probably like a baby thesis, I would say, like something really small. And I
Mm.
had chosen to do something focusing on genetics and kind of like clinical trials focusing on very hyper-specific mutations and targeted therapies. And, I didn't know at the time that systems medicine was a program that was available to us. So while I was kind of doing this PowerPoint and this long paper on this, I was kind of just researching and just like generally kind of looking around for more information. And I found that Georgetown had this program. I applied very quickly and I got in very quickly. And
Mm.
so it was very much a whirlwind. And it very much is a testament to how everything happens for a reason because I went to Georgetown, I took all these incredible classes. Dr. V made it her absolute mission to kind of help us explore our interests and get us to where we want to be in our careers and our lives. And so I was able to do some research as well as some clinical work and some shadowing, and I realized that I really wanted to become an advanced practice provider or nurse practitioner. And she kind of guided me and mentored me throughout the process of applying to that. And I started my nursing program like right after systems medicine. So this very much was like a kick-starting point for me doing this program, and it's something that I will always look back on fondly. And Dr. V, like I said, continues to be a mentor, and so I'm very grateful for my experience at Georgetown.
That's awesome. So coming out of undergrad, I think a lot of students probably experience the same thing. I certainly did myself of kind of, not knowing exactly what to do. And so it sounds like Dr. V especially, but also Georgetown and the systems program were kind of instrumental in shaping something or like forming some kind of a path. Is that right?
Yeah, absolutely. So where I went to undergrad, it was a very, very large institution. A lot of my classes had like close to 1,000 students in them, and it was really hard to find good mentors. Even those that were willing to kind of give advice were so spread thin. I mean, it was a public institution, so like for example, our counselors had like a caseload of like 400 students each. So it was hard to even get an appointment with them, let alone kind of sit down and really talk about like what my concerns are and what I want out of my life and my career. And so when I came to Georgetown, it was very much like a breath of fresh air. Like Dr. V was so available to us. She very much like even tailored certain parts of the curriculum to, things that we said that we wanted, which was so special. And even outside of just systems medicine specifically, I remember meeting with some of the kind of people that work in BGE and things like that. And I was still kind of questioning a little bit towards the end of my first semester, like, should I become an NP? Like, should I just go to medical school? Should I focus on research? Like, what should I do? And so I met with somebody just like in the BGE office, and we went over the logistics of applying to different programs and like what made sense for me. And like that was kind of like my final, okay, like I kind of know what I want to do now, which was so helpful too.
Yeah, that's great. I'm glad that BGE has that kind of like, person-to-person guidance.
Yeah.
That's really nice to hear. Um, so what led you to kind of go? I mean, I know you have your bachelor's obviously and the MS from Georgetown, but you also have the MSN and the DNP.
Yeah.
So what uh what does each kind of successive step after the MS in systems medicine at Georgetown, what does each offer and how is it kind of played into what you do now?
Yeah, so while I was in my second semester, my last semester at Georgetown, I was able to work with Dr. Collins, who is a really world-renowned radiation oncologist focusing on prostate cancer. So I worked with him as well as some of the nurse practitioners on his team. I did a little bit of like a clinical focused research project with some of his residents and fellows. And during that time, I spent a lot of time shadowing both him and the other providers. So that kind of allowed me to focus on like oncology, and that's kind of why I'm doing that now. But also kind of helped me help make my final decision that I wanted to become a nurse practitioner. So when I met with Dr. V and I kind of told her like, oh my gosh, I had this realization, like this is what I want to do. We kind of researched together, and I found this program at Columbia that was an MSN to DNP. A lot of times to become a nurse practitioner, I mean, all the time you have to become a nurse first. And this program kind of did it seamlessly. So I decided like this would be the quickest way. This would be like the most well-rounded way to do this. And so I kind of applied while I was in systems medicine and found out that I got in. I started my journey there. It was very intense. It was like a full-time job. It was 15 months, very quick. And then once that was over, there was an option to continue on to do the DNP there. But unfortunately, the coronavirus pandemic kind of hit. So a lot of things
Yeah.
went remote, and it just didn't seem to make sense to continue there based on like finances and some other things. So I decided to kind of take a year, get some clinical care as a nurse, which was so helpful. It was so intense being a provider, like a nurse at that time. And it was very much like orientation by fire. I learned like a lot of different things in a very short period of time. And then I started my DNP at a different institution, like maybe like a year later, while I continued to work. And I always say, again, everything happens for a reason, because if I stayed at Columbia and did the whole program there, I probably wouldn't get bedside experience.
Mm.
I truly think that was like the foundation to who I am as a provider now, is getting that experience at the bedside and seeing like the challenges with patients, what they go through on a day to day. All of that was so helpful. And so that kind of led me to where I am now. Definitely not an easy journey that year because of all of the turmoil surrounding all the patients being, so sick and deteriorating, and us not having so many resources. But it was very much like a foundational knowledge that I really needed.
Yeah. Well, that's really cool. Could you explain what you do now? I know that you work at the Memorial Sloan Kettering Cancer Center, which I understand is a pretty prestigious institution to work for. So could you explain kind of what you do there?
Yeah, absolutely. So when I finished my DNP, I knew I wanted to go into some sort of subspecialty care. So my DNP focused on me kind of becoming a family nurse practitioner and getting that certification. And a lot of times when you have that degree or that certification, you end up working in outpatient or
Mm.
in primary care or something like that. Oncology is a very niche kind of profession and field. While I was in my DNP, I was kind of doing some more research, kind of like I did in my undergrad, and I found out that Memorial Sloan Kettering has this fellowship for advanced practice providers. It's about a year long. There's so many different options, and I really had to do some soul searching to decide what I wanted. And so I ended up doing the solid tumor track. So I did that for about a year. They rotated us through all the different solid tumors. So we did like breast, GYN, thoracic, genitourinary, all of these different things, and also some like subspecialty areas that we got to choose ourselves, which was very cool, like as electives. And so while I was there, I got to do inpatient and outpatient work, and it really kind of helped me understand where I wanted to be. And so I kind of focused and honed in on like kind of women's health. And now I'm an advanced practice provider on the inpatient side, on the breast and GYN teams. And so I kind of float between the two, which is like really nice variety. And it's something that kind of, I always say that sometimes you do something and it just kind of clicks.
Mm.
That makes sense. And that was kind of like that click moment for me during fellowship, was those two teams. And so it's been really wonderful. And the patients are so lovely. And there are a lot of difficult conversations and like complex kind of medical issues to like face and deal with. But it's like really like made me a better provider, I think, over the course of the last year and a half.
Yeah, that's wonderful. I really admire really a lot of health professionals actually. My dad is an emergency doc.
Oh
Um,
my goodness, that's so rough.
yeah, yeah. So I hear the stories, but yeah, I have a pretty deep admiration for, people who take, you know, healthcare seriously and taking care of other people. Is that like I don't know, it's kind of a gimme question, but like could you speak a little to like the satisfaction that you get out of the work and like the why, like why you do it?
Yeah, absolutely. So I'm first generation here in the States, a first generation student and kind of like
Mm,
college graduate. And so I always think back to my own family, like they moved here probably in the late 80s, early 90s, kind of like trying to get away from war and violence and all of that back where we're from. And they've had so many different chronic health issues over the years. And I just like think back and I wonder how they survived all of that because to have these language barriers, to have these cultural barriers, just like not having the education here, is so difficult. And I see that there are so many disparities for these patients, even patients that were born and raised here. And, like if you don't have medical knowledge, you just don't know what to ask for and what to look for.
mm,
There's so many gaps in care. And I think that's probably like the driving force of why I wanted to do this. I've seen, people in my own family not get proper care. We have stories of family members back home that should very much still be alive that didn't have access to proper care. And so if I can make a difference in any way, kind of helping patients that otherwise would not get good medical care, it's something that is very satisfying and fulfilling for me. And actually during fellowship, I had a very like deja vu type moment. Like I took care of a patient that spoke the same language as me. She had just moved to the States a year prior. She had lived in a refugee camp for several years. She had gotten diagnosed with like early stage breast cancer, had a resection, just did not have proper follow-up or education. So she didn't end up taking her hormonal therapy. And then
mm,
she ended up at MSK. Just trying to establish care because it was a last ditch kind of Hail Mary effort. And she had metastatic disease like all over her body and just didn't understand why this happened. Didn't have a place to stay. Her husband lost her job trying to get her to the hospital. She had many kids. She had several kids in a different state. She had a young child with her. It was just like probably the worst possible situation you could imagine. And it was just so like heartbreaking, but also fulfilling to get to sit there with her and like I took a couple of extra minutes. I helped them get a place to stay for the night. Like I translated for them. I explained kind of what she was there acutely for and the time that I had. And, those interactions are just so like meaningful to me.
mm.
And it's just like a real privilege to be able to kind of provide that for anybody, really.
Yeah. That's wonderful. That's really nice. And I'm glad that I'm glad that you do this. This is I'm glad that you found your calling. This is
Thank you.
it's very it's great. Um I guess do you have any advice for any maybe current students or like potential students? I know that you serve do you still serve as an academic mentor at Georgetown?
So I took the spring off, but I very much am planning on helping like for future semesters. I think I was just kind of transitioning into my full-time role outside of fellowship, so I took a little bit of a break, but it's something that's so meaningful and that I love to do. So I'll be continuing to be a mentor just, in future semesters.
Awesome. So yeah, what kind of advice do you have for really I mean, I guess potential students, current students, or anybody in the field, I guess, you know?
Yeah, absolutely. So I would say for students doing systems medicine, I think a lot of times, like in our cohort especially, I think we were all so happy to be there and learning so much, but we were all just so worried about the future because we were kind of in this area where we're trying to figure out what we want to do and applying to other professional programs. And I would just say like absorb everything you can in the moment. Like you have such amazing mentors at Georgetown and they're all there to help you. And this is just not something that's going to be available to you moving forward. I
Mm,
mean, it very much could be depending on what schools and institutions you end up working in and studying in, but it's just not common. And it's something that I noticed as soon as I left is that, wow, that was special, and that's not something that's always available to you. I would also say take advantage of every opportunity that you have. A lot of times when students are so like they have such tunnel vision, this is what I want to do, that something is offered to them and it doesn't immediately make sense in the moment, and they say, oh, no, 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 like I'm okay. But I think, just being open and flexible to different opportunities might actually really shape who you're meant to be. Like everything, again, I've said this like 50 times, but everything really
mm,
does happen for a reason. I never thought that I would end up in DC doing systems medicine, and I did, and it like shaped my whole career basically.
mm.
So you just have to be open to like the universe, whatever opportunities come your way, and just be like teachable and flexible and, saying no to something might, show that you're not a flexible person or you're not, amenable to doing different things that you didn't initially, see yourself doing. And that might close you off to other things in the future. Being an open person, being like enthusiastic, being teachable is really important. And it's like those are like core skills that you need to be a clinician or a researcher or anything. And so I think, that's probably my biggest piece of advice.
Great. Yeah. That's good advice for anybody. That's good life advice.
I would just say like there are so many opportunities out there and you just have to be open and look for them, that's really the only other thing that I would say to any student or anybody that wants to go into any sort of health or research profession. Sometimes you find things and you don't expect to, and that's kind of been like my whole career so far. So
Yeah. Well, that's great.
yeah.
What's next for you? Are you I guess happy and content at your current job and gonna, keep doing it?
Yeah, I really love what I do. I think the patients are so wonderful and so grateful,
Mm,
despite how challenging kind of their reality seems to be, most times. I think this is definitely something that I want to continue to do. I'm just kind of trying to edge into doing a little bit more research as well, like maybe some clinical trial research or like some more academic research. So, I think I'm very early in my career still, so I'm
mm.
just trying to kind of be open to whatever comes my way.
Yeah, definitely. I think a lot of students are probably interested in doing some kind of research, whether they're system students or other BGE programs. Is there was that a part of your journey at Georgetown or academically? Was research a big component to it, and what kind of opportunities were there?
Yeah, so during our second semester we did, I believe it was called a capstone, if I'm not mistaken, and Dr. V kind of met with all of us individually and asked us, what do you want? Like, what's your dream? What areas are you interested in? And she kind of helped try her best to match us to things that she thought would be helpful.
Mm,
So for me, she matched me to something where I could do like clinical shadowing, but also do like a project focusing on like PSA levels and like prostate cancer recurrences and things like that. So that's very much a big part of the curriculum. And also since leaving Georgetown, I found different opportunities where I've done like summer fellowships and like even during my DNP program, it was more like quality improvement research, but it was still research. So there's definitely going to be opportunities to do research after Georgetown, regardless of whether you go into a research profession or you go into a clinical profession. Research is very much like foundational for, like kind of like clinical decision making and questioning and critical thinking, and it's something they very much encourage. So it's been like a big part of my career up until this point, and
mm.
now I've kind of been doing more like quality improvement research mentoring at MSK and things like that. But I'm definitely looking forward to doing some more things where I'm like kind of spearheading it myself. So
Nice. Yeah, that's really cool. This will be the last one, I promise.
okay,
What what are some other paths of like people in your cohort that you know of? Like does everyone does it have to be like clinical or research? Is that kind of the way that pe it goes?
no, so I know one of my colleagues, I haven't spoken to her in a bit, but I think she also works at MSK. She works in like bioinformatics,
Mm,
which is very cool. So you could get like industry jobs after doing systems medicine as well. I think it's all about networking. Like
mm,
Dr. B has so many different amazing kind of professionals come in and speak to us, and they're not all like clinicians. And so just like networking with them, I always say like you can get in touch with people via LinkedIn after they come and give a lecture, just like being very strategic and like just like enthusiastic about what you're learning and what you want to do. And it opens so many doors. Like you would be so surprised at how many people are willing to take you on and allow you to shadow or, do like an internship after or even during the program. So I would say, a lot of people went into research. A lot of people went to medical school. There were some people that got like their PhD specifically or ended up getting some sort of job in like a lab, but
mm.
there's also people that ended up like in industry and hospitals doing kind of more like data-driven work, which is great as well.
Yeah.
Systems medicine is like so close to my heart still, and
Mm.
I love to help and advocate for the program in any way that I can, and I look forward to continuing to do that. So
Well, we really appreciate it, and I appreciate your time and getting to meet you a little bit and learning about what you do. I'm very impressed, and I'm glad there are people like you out there.
thank you so much. Thank you
Yeah,
for being with me, and I look forward to seeing where this ends up. So
yeah, we're very excited about this.
good stuff.
All right, thanks, Zoe.
Yeah, no worries. Have a good one.
You too.
Bye.